expired. The chair now recognizes the gentleman for Virginia, Mr. Griffith. 5 minutes for questions, please.
Thank you, Mr. Chairman. If anyone could respond to this, or all of you, in response to Chairman Upton and Ranking Member Waxman's letter and questions, Virginia Governor Terry McAuliffe raised the issue of allowing coverage of medically necessary institution for mental disease, IMD, placements for CHIP-eligible children, which is currently available to children on Medicaid. Given the work that this committee has done on mental health under Chairman Murphy, or in the Oversight and Investigation Committee that Chairman Murphy chairs, during this past year, and hearing that testimony, of course, being aware of the tragedies that took place, while it may not have been helped at Virginia Tech and elsewhere in Virginia, I think this is something that ought to be considered. Do any of you all have thoughts on whether or not CHIP should include providing this type of mental health coverage?
I would just say that MACPAC has, in the last, beginning this fall, has begun a focused inquiry on behavioral health services in Medicaid and CHIP. We're still learning and identifying the problems and concerns. Coverage in institutions of mental diseases in Medicaid has certainly been a concern, and that will be an area where you'll see more from us in the future.
Because one of the areas, just to underline this for you all, one of the areas that we have identified in Chairman Murphy's hard work on this issue and those of us on that committee is that so many young people, particularly young males between the ages of 14 and it goes over to like 28, which would not apply to CHIP, but particularly those 14-year-olds I'm concerned about and up to the 18 age, they're not getting treatment. They know there's something wrong. The families know there's something wrong, but they're not even going in to get treatment for over a year before they begin, and that creates a lot of, or starts the process in a lot of cases that ends up in very tragic situations without getting that treatment. All right, let's move on to other subjects while I still have some time. The American Action Forum, run by former CBO Director Doug Holtz-Eakin, estimated in September that 1.6 million children currently in CHIP would fall into the family glitch. Ms. Baumrucker, can you explain for those who might be watching this hearing later or now, what is the family glitch and why is that of concern, particularly related to CHIP?
So under the regulation from CMS or IRS, affordability for whether or not you have access to insurance coverage that is affordable, so whether you would have access to subsidized coverage through the exchanges, is defined against an individual, not a full family. And so the idea behind families that would fall into that family coverage glitch is that they may have access to employer-sponsored insurance, but that insurance coverage would be under the 9.5% of their annual family income, and so would be considered affordable, but may or may not be based on their income against poverty level.
Okay. So if I can clarify, and I understand it, but I want to make sure the public understands it as well. What you're talking about is that in order to be affordable, it has to be 9.5% of the individual's income or the family income. But that's determined against the individual employee's wages, and if they happen to have, particularly in a single-parent household, and they have 3 or 4 children at home, when you add the cost of covering the children, it's no longer 9.5% or less of their income. It goes up above that, but for purposes, the Affordable Care Act did not take that into calculation, or at least the regulations based upon the Affordable Care Act did not take that into consideration. And so we have families out there who, notwithstanding the fact it's deemed affordable by the Internal Revenue Service, it may not be affordable. Is that a correct restatement of what you said?
I would agree with that.
I appreciate that. Thank you so much. That being said, and I'm going to have to truncate this a lot because I talk too much, which often happens, dental insurance. There's a real concern there with the dental insurance aspects related to the Affordable Care Act, and of course we know there was the double counting issue. Related to CHIP, what can you all tell me about how many children are currently getting dental services under CHIP and how this may be impacted as well by the Affordable Care Act? And I saw Ms. Yoakum nodding. I'd be happy for you to give me an answer. And I have 20 seconds left.
Okay, no pressure. We did we did do some work on dental, and it's sort of a good news, bad news. The good news is dental coverage and dental use of dental services in Medicaid and CHIP has actually shown some improvement over the last few years. The bad news is it's still not on par with private insurance. Okay.
I appreciate that. My time being up, I yield back. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. And
Mr. Chairman?
Ms. Capps, you're recognized for UC request.